Hello and welcome to the program. I'm your host, Neil Howard, here on Health Professional Radio. Glad that you could join us today. The Crohn's and Colitis Foundation and the Patient-Centered Outcomes Research Institute have a brand new clinical research study called DINE-CD. This study is the first ever national randomized trial of 2 dietary interventions to treat Crohn's disease. Joining us on the program today are Dr. James Lewis. He's the primary investigator on the study, and he's joining us to talk about the latest research on IBD Crohn's and how DINE-CD might help to change the way clinicians and patients view the role of the diet in the treatment of Crohn's. He's joined today by Andrea Meyer. She's a Crohn's disease patient and an active member of the study's research team. Welcome to the program. Thank you both for joining us today.
Thanks for having us.
Well, what are inflammatory bowel diseases, and can you tell us what some of these conditions are that fall under the inflammatory bowel disease umbrella?
This umbrella refers to 2 main diseases, Crohn's disease and ulcerative colitis. They're very similar, the major distinction being that ulcerative colitis affects only the colon, whereas Crohn's disease affects any parts of the intestines. And both diseases are chronic, relapsing diseases where there's ongoing inflammation.
Can you tell us about some of the symptoms of IBD, how and when it's diagnosed?
The main symptoms are diarrhea, which is often bloody, abdominal pain, and weight loss. Some people have additional symptoms such as arthritis or irritation of their eyes. It's most commonly diagnosed in people in their teens or 20s, but can be diagnosed as late as even those over the age of 60.
Why is diet such an area of interest for IBD patients? And, talk about maybe the impact that diet has been shown to have on patients.
I would say as a treating gastroenterologist that diet is particularly of interest to patients because it's something that they can take control of. In addition, it's sort of intuitive. If you're having abdominal pain, you're having diarrhea, you begin to ask yourself, is something that I'm eating making my symptoms better or worse? From a scientific standpoint, we know that there's evidence that what you eat before you're diagnosed may influence the likelihood of new onset of the disease. And there's even some evidence that very extreme restriction diets can be used as a treatment for Crohn's disease. We're interested in finding more palatable diets that can be used as a treatment.
Andrea, talk a little bit about your story and how Crohn's has affected you.
Sure. I was diagnosed with Crohn's disease 18 years ago now. I have had fairly normal experience, similar, I guess a lot of patients out there would relate to my experience thus far, where for a decade or more I had varied symptoms that would come and go, and I was on and off of different medications. And only recently, probably the last 5 years or so, I've had really great success managing my disease with diet, which led to my interest in becoming involved with the DINE-CD trial.
Dr. Lewis, talk about this DINE-CD study and what you hope to learn from the study's results.
So the DINE-CD trial is a randomized controlled trial of 2 different diets for patients with mild to moderately active Crohn's disease. The 2 diets are, the first is a completely organic, additive-free Mediterranean-style diet, one that has been used in many studies of other conditions and thought to have a variety of health benefits. The second is a diet referred to as specific carbohydrate diet, which also will be completely organic and additive-free, and has some anecdotal evidence that it has benefits for patients with inflammatory disorders. However, the 2 different diets have never been compared head-to-head before to know whether one is better than the other. So in this trial, what we hope is to learn which one is more effective so that when patients come to their doctor and say, "What should I eat?" we can have a more intelligent answer.
Our listeners would like to learn a lot more about this DINE-CD study and Crohn's disease. Where can they go online?
For more information about IBD in general, I'd recommend that they go to the Crohn's and Colitis Foundation website, which is crohnscolitisfoundation.org. There's also a subpage there where they can learn about participating in clinical trials by looking at the clinical trials community. And then for information about this trial specifically, they can go to clinicaltrials.gov. And there, if you type in the word DINE-CD as the search term, it'll bring up information about this trial.
Dr. Lewis, Andrea, thank you so much for joining us today.
Thanks for having us.
You've been listening to Health Professional Radio. I'm your host, Neil Howard. Transcripts and audio of this program are available at hpr.fm and healthprofessionalradio.com.au. You can also subscribe to this podcast on iTunes, listen in and download at SoundCloud, and be sure and visit our affiliates page at hpr.fm and healthprofessionalradio.com.au.
Thank you for listening to Health Professional Radio. We're very proud to be an independent broadcaster providing our content free of charge to you, the listener. One of the ways that we're able to remain free and independent is by having people like you become patrons. You can support Health Professional Radio simply by visiting hpr.fm and clicking the button that says Become a Patron. Your patronage of even just $1 a month lets us know that you're there, which in turn makes us more valuable to advertisers. And, of course, if you're able to afford more, then we would certainly appreciate the support. My name is Toby Longhurst from Health Professional Radio. Please visit hpr.fm, click the Become a Patron button, and support us if you can.